Okay, so the femoral nerve that we spoke about just a little bit, and we will talk about it in details now. We isolate it. The femoral nerve, as we said, is one of the biggest peripheral nerves of the lower limb. It has nerve roots from L2 to L4. Okay. It innervates muscles of the thigh, the anterior compartment, and it also helps in extending the knee, and I will show you how. So let's select some muscles. You can see that it controls iliacus, for example, sartorius. One second. Here. Iliacus, sartorius. It controls iliacus, sartorius. So if it controls iliacus, it is able to cause contraction of iliacus, hence flex the hip joint. If it controls sartorius, same thing, hip joint. If it controls the vastus lateralis, the rectus femoris, vastus medialis, they hence can also extend the knee. So the femoral nerve is able to control those, causing effect to the hip joint and the knee joint. The sensory function supplies cutaneous branch to the anteromedial thigh. Here, anteromedial thigh. And medial side of the leg and foot. You can see that the nerve goes down. It will supply sensory innervation to the skin of the medial leg and the foot. Okay? So that's the general function. The course.
Sorry, once again, cutaneous innervation, the anteromedial thigh.
Anteromedial thigh, medial leg, and foot.
Okay, thank you.
Okay. It is the largest branch of the lumbar plexus and derived from where? L2, L3, L4, as we said. It then travels inferiorly to the psoas major. As we said, psoas major is a muscle that the lumbar plexus branches are involved with. It travels inferiorly to the psoas major. Okay. It has branches to so many muscles, as we said. And just to let you know, when you are saying your course, you go from near the lumbar region, travels inferiorly to the psoas major, passes underneath the connective tissue here, the inguinal ligament, to enter the femoral triangle, and the femoral nerve divides into anterior and posterior divisions. Okay. Now, the anterior division of the femoral nerve and the posterior division of the femoral nerve has branches. Okay. The anterior division, as it passes through the inguinal ligament, no, the femoral nerve passes underneath the inguinal ligament, it will divide into anterior branches and posterior branches. The anterior division, it has branches such as anterior cutaneous branch, branch to the sartorius muscle, and branch to the pectineus muscle. These are the three branches from the femoral nerve. The posterior division of the femoral nerve, it has saphenous nerve and branch to quadriceps femoris. That's the posterior division of the femoral nerve. Okay. As we said, motor functions of the femoral nerve, it is a hip flexor and it's a knee extensor. It's a knee extensor as it causes quadriceps femoris to contract. It's a hip flexors as it causes pectineus, iliacus, and sartorius to contract. So I'm speaking about here. It causes iliacus. It causes sartorius. It causes, where's the pectineus? It's not here. Here, pectineus. To contract, they flex the knee. It causes, again, rectus femoris, vastus lateralis, vastus medialis, vastus intermedialis to contract, hence causes flexion of the knee, extension of the knee, sorry. Okay. Sensory, we have anterior cutaneous branches and saphenous nerve. These are the sensory branches. The sensory branches are, again, anterior cutaneous branch, which is coming out from the anterior division of the femoral nerve. They supply the skin of the anteromedial thigh. The saphenous nerve, as we said, comes out from the posterior division of the femoral nerve and supplies the skin of the medial leg and the foot. That's what we said. We go back. That's
Uh,
the end of the. Yeah, go ahead.
Once again, so you mentioned the pectineal branch, anterior cutaneous branch of femoral nerve, then sartorius branch, and saphenous nerve. But we also, I have notes from the class, and we have like proximal muscular branches, distal muscular branches, and articular branches. What are they like?
Okay,
I
let's
don't know.
see. I actually don't know that, but let's see here what we have. So these are the. Okay, let's see. So femoral nerve, largest branch, anterior compartment, origin. Okay, we know this. Emerges. This tells you how it moves. Let's see branches. The motor branches of the femoral nerve. It supplies iliacus, pectineus, 1 to 2 branches to sartorius, and the quadriceps. These 4 motor branches. And then you have, mm, here. No, 1 second. So you said distal proximal, right?
Yeah, proximal distal muscular branches and articular branch.
Yes, I think the proximal is what I meant here because it makes sense. The proximal branches are the iliacus, pectineus, and sartorius because they're proximal here.
Mhm.
Oh, where is it? Here. These are proximal, so these are proximal muscles. But then you go distal, these are distal branches that supplies the muscles downwards a little bit more distally.
Mhm.
Okay, that's just the sense of it.
What
And
about articular?
articular here, you have um, there's, as we said, we have anterior division and posterior division, right? The anterior division, muscular branches to sartorius, cutaneous branches, medial cutaneous nerve of the thigh, intermediate cutaneous nerve of the thigh, posterior group of branches, posterior division. Hence, muscular to pectineus quadriceps, cutaneous, and then you have the articular branches here to the hip joint and the knee joint. Okay.
Mhm.
Muscular to pectineus and quadriceps. Of course, the posterior group of branches include muscular, they control pectineus and quadriceps. This is to control the hip joint, this is to control the knee joint. Cutaneous branches, the saphenous nerve from the posterior division, as we said. And the articular branches to hip joint from the nerve to rectus femoris. So basically, they supply or reach the hip joint and also articular branches to the knee joint. There are branches that reach from the posterior division of the femoral nerve to go to the branches of go to the knee joint, hence to um, control quadriceps muscles. Okay. Um, so how this is how it's division: femoral nerve, anterior divisions, posterior divisions. From the anterior division, you have these. Posterior division, you have these, and then this just comment generally on them. You have the first comment is that motor branches of femoral nerve are branch to iliacus, branch to pectineus. These are proximal, and then distal, quadriceps. Then you have articular branches here, as we said. branches to hip joint, branch to knee joint, and then you have vascular branches to femoral artery and its branches. So also the nerve supplies the arteries. Why? Is because the arteries need to constrict or dilate. And then again, we go to the cutaneous branches of the femoral nerve, supplying what? The skin. Intermediate cutaneous nerve of the thigh, medial cutaneous nerve of the thigh, and of course, saphenous nerve that comes off the posterior division. Here, posterior group, saphenous. Okay, that's the end. So, femoral nerve is quite of a nerve, but easy as it is. L2, L3, L4 is its origin. This is the course where it emerges and where it ends. It has an anterior division and a posterior division. The anterior division can supply muscles and can supply skin. From the muscles, it supplies the sartorius muscle through the anterior division. From the skin, it gives medial cutaneous nerve of the thigh, intermediate cutaneous nerve of the thigh. Okay. From the posterior division of the femoral nerve, you have muscular supply, supplying pectineus and quadriceps. The skin, saphenous nerve. From the posterior division, an extra thing, you have an articular branch that supplies hip joint and knee joint. All of this comments on branches is just what we mentioned here, but they dive deeply into each. For example, motor branch of the femoral nerve, here, iliacus, pectineus, just separated. Okay? You're just repeating the words. Okay, that's the femoral nerve. The next big, we can check it next